Hi, everyone. So, welcome to Professional Conduct. The topic for today is essentially exploring how mental health providers are expected to act. And really, there's going to be specific kind of guidelines and rules with that, known as scopes of practice or codes of ethics. So, we're going to talk about that. In addition, because the mental health field has been really embracing team and intercollaboration, we're going to focus on how to kind of work as a team. And then finally, it's going to be really important, I feel, to understand or have some sort of snapshot of the different mental health professions or common mental health professions and their kind of philosophical and well as educational background and mainly what they typically focus on. So we're going to start with that today. So let's begin. So, what do we mean by professional conduct? Well, essentially, professional conduct are guidelines on how an individual associated with an occupation, such as social work, psychiatry, psychology, should act while performing the duties of the job. So, typically, those professional conduct kind of guidelines are determined by regulatory bodies like associations. So, it could be the American Psychological Association or the American Counseling Association, and then licensure. So that could be like in the state of Maine, we have a board of professional counselors, which oversee the compliance and as well as the determination of who can be licensed and possibly the sanctions for individuals who break the code of the standards, as well as certification boards, such as the National Board for Certified Counselors. So professional conduct, again, is typically written in a formal guideline, so some sort of piece of paper that you could access on any of these associations or licensure or certification boards websites. And they can have many names, such as code of ethics, a practice code, or scope of practice. And essentially, it details how the individual should behave, what ethical standards this individual should follow or strive to, as well as what the professional can and can't do depending on the training and the setting. So, for example, in certain states, there's going to be a variation on what a mental health professional can and can't do. For the most part, psychologists cannot prescribe medications. However, there are a few states where that exception exists where those providers can provide, or excuse me, those psychologists, clinical psychologists, can provide certain medications. And so that state has those unique differences while other states do not. So another part is it's not uncommon for a mental health provider to be affiliated with with to be affiliated with various professions and associations. And when you're affiliated with those very different regulatory bodies, it is going to be vital that to know that you're responsible to follow those multiple professional conduct guidelines. So for example, let's say we have a counselor. Um, the counselor is going to have to follow the guidelines or is responsible for following the guidelines in whatever state their license is. If they're a member of the American Counseling Association, those are more guidelines that they'll have to follow. And let's say for the scenario, the counselor is a registered play therapist through the Association of Play Therapy, and that registration or that certificate essentially is going to have specific guidelines that that counselor should follow as well. When an ethical dilemma occurs, it is vital that that counselor is going to view all those different regulatory bodies, scopes of practice, or whatever name they're using to help make a determination on what is the best or possible action that this individual should follow. So essentially with all that I just said, it's important to be aware of the different kind of expectations, the practice guidelines, and the professional conduct for whatever association, license, or group you are affiliated with. Finally, it is becoming more common that professionals from different disciplines work as a team to accomplish specific goals. So, in the age of managed care, it's becoming more and more common that a provider is going to be on a team to help the consumer the best they can. And a major element of that is as we go on through these slides, you'll see that all the disciplines typically have a unique focus and expertise. And the human beings, again, we are complex and there's many areas that may impact our lives. And so that's why having an interdisciplinary team can be beneficial. So that's why I want to kind of focus now on working on a team. So again, it's not uncommon that a consumer of mental health care will have a team of mental health professionals who play various roles and are going to address various elements of the consumer's life. So teams can vary in makeup and roles depending on the state, the setting, whether it be hospital, outpatient agency, a school, or maybe a wellness center at a college, the age of consumer, and presenting concern. So to give some background, a lot of my experience comes from working at college wellness centers. And typically, again, there's always exceptions to this, but typically a wellness center is broken into two parts. You have the mental health side, counseling, psychology, whatever the name is being used. And then you have more of a health services side, whether that be nursing or it's more of a medical model. Now, those consumers, i.e., the students, are also known as students, typically can access both sides, and they typically do. And so it's going to be helpful as working as a team because it's not uncommon that I will be working with the client from the mental health side who's also working with a provider, whether it be a nurse practitioner, a psychiatrist, or other kind of allied health professional. And typically, or excuse me, what can be beneficial is especially when there is psychotropic medication involved. So as a counselor, I cannot prescribe medications, but there are times that clients or students can benefit from medications. And then it will be helpful having a collaboration where a prescriber prescribes the medications and then the counselor provides the mental health or the psychotherapy treatment. Now, this why overlapping teamwork can be beneficial. Just kind of the makeup of the different professionals is I, as a counselor, have the ability to see someone more frequently and for longer duration than a typical medical prescriber, whether that be a nurse practitioner, psychiatrist, or other type of physician. So physicians, just because of the way the system is structured, you're talking about seeing someone for typically 15 minutes, maybe more, maybe less, depending on the situation. Um, and that may be, that's not every week. It could be once a month, every few months to do checkups here and there. Compare that to a mental health provider where we typically have what we call 50-minute sessions or a 50-minute hour. And essentially, I can see someone for 50 minutes, have a detailed, deeper conversation of what's going on for that person, as well as any thoughts or concerns. And then I can also see that person more frequently, just the nature of the work compared to a provider. So with that, I can gain quite a bit of information that may be relevant to the provider and then vice versa. So that's why working as a team is going to be important to have those skills. Even now, as a private practice counselor, where I'm the only one in my clinic, I still am working on different teams outside of the setting, whether it is interacting with other psychiatrists, other referral sources, let's say a sex therapist, couples therapist, or family therapist, or maybe even an occupational therapist, you name it, there's going to be different times where I have to collaborate with other individuals to provide the best care possible. That's why I want to focus on team working tips. So, for many mental health providers, we know that communication is very important, and working on a team is no different. So, when working on a team, communication is key. Therefore, make sure to clearly state what is needed and to provide a check in statement. So, once you say what's needed, you can check in by saying, does that make sense? Is there anything I'm missing, etc. For many of you who have background training with micro skills or person centered therapy, this is very kind of, you're naturally used to this when you do a summary and then you check in to make sure that you're understanding what the person is experiencing or stating. The other thing to remember is you do not need to be best friends with the colleagues, but respect is going to be important. Having some sort of respect for the others is going to improve or continue team collaboration. When team collaboration breaks down, not only is that awkward and uncomfortable and frustrating for us, but the care and quality for the consumer can be impacted greatly. So remember that when you are working with a team, especially as a professional group, your goal is to work for the consumer. So you're working together in order to best help the consumer. That's why establishing unified and clear goals that the team can work towards can be very beneficial. Finally, be open to suggestions, and it's okay to admit you don't know something. And I feel this can be sometimes the most difficult element because when we're working on interdisciplinary teams, our egos can get involved. Many of us on these teams have a lot of training, credentials, status, and power. And we are supposed to be experts. And sometimes experts, or being in the expert role, it is hard for us to show vulnerability or humility. The thing to remember, and hopefully this really solidifies as I go through the slides, is you are an expert in your field. You're not an expert in everyone else's field. So again, as a counselor, I don't know crap about medications. I have some sort of understanding, but I am not trained, nor am I allowed to prescribe meds. So, with that being said, that's outside of my scope of practice. If I have a client who has questions about medications or concerns about medications, or if, let's say, a psychiatrist is talking about medications and I just don't understand what's going on, it's okay for me to ask that I don't know, or can you explain that more, or can you help me understand that better? That's okay. Being humble can be very beneficial. But I understand, especially being a new student or new in the field, we can feel that showing vulnerability is weakness. But remember, you don't have to know everything, nor are you expected to know everything. So it is okay to be open to feedback and to also admit that you don't know something. Again, the whole purpose of working on a multidisciplinary team is to help the client or clients the best we can. So now I want to shift into really exploring the common professionals in the mental health field, and this is mainly geared towards the United States. And also understand that this is not a comprehensive list. There are numerous different avenues of mental health, the mental health field in general, and I'm just kind of focusing on the most common. But again, I am definitely leaving things out. In addition to that, too, this is just a snapshot. There's always going to be exceptions to the rules with these, but hopefully this just gives you some sort of framework to help understand. So let's start off first with psychiatrist, the term that most people know. And it is besides psychologist, I get called a psychiatrist quite common, and I'm not a psychiatrist. I don't have the experience or training for that. So let's kind of start with the training. So psychiatrists are typically, for the most part, are going to be trained in the medical model. And I'm going to talk about the medical model in the next slide. And they are allowed to prescribe medications. A typical degree is going to be the medical doctor, MD, and doctor of osteopathic medicine, DO. Now, understand that even though there's two distinctions, they are allowed to do the same type of work. There's no distinction in the work or things they can do. They just come from different philosophies of school. So there's a distinction between the training. Doctor of osteopathic medicine typically focus more on like manipulation of the body and more hands-on, somewhat kind of holistic approach compared to medical doctors, which have a strong, I shouldn't say strong, but they're traditionally medical doctors have a great more of a research component to it, but not always. So just if you see an MD or a DO, they're both doctors, they're both psychiatrists, they can do the same stuff. The major association is the American Psychiatric Association, also known as the APA. This where in the mental health field, there is a lot of confusion and complication. So this is going to show you the first complication. In the mental health field, we have two APAs. Again, we have the American Psychiatric Association, and then we also have the American Psychological Association. So whenever you have to do APA format, that's the Psychological Association. Whenever you're using the DSM, which I'm going to talk about in the next section, that's from the American Psychiatric Association. So we have two APAs. Fun fact. With a psychiatrist, a typical academic training route is going to be 4 years of undergraduate, 4 years of medical school, residency in psychiatry, and then maybe some fellowship. So, fun fact, again, as I mentioned before, the Diagnostic and Statistical Manual for Mental Disorders, so currently we're in the 5th edition, is published by the American Psychiatric Association. So that's key. The DSM has a strong focus from a medical model. Essentially, think of the DSM as a list of symptoms clustered together to give some sort of name. Typically, the DSM does not have a cause of why this disorder exists, nor does it emphasize what to do or what treatment to provide. It's just a reference guide that, okay, here's a cluster of symptoms this person's experiencing. Let's smash them up. All right, they meet the criteria then for this disorder. So let's move on to the medical model. So again, psychiatrists come from the medical model perspective. The medical model is going to view mental health as stemming from physiological or organic causes. So typically what happens is we have a set of symptoms, and with those symptoms, we have a diagnosis, and that diagnosis guides us to do some sort of treatment. So mental health symptoms, again, are causing, excuse me, let me step back for a second. So yeah, so with the medical model, we're going to treat the symptoms because the symptoms are causing ailments in a person's life. And really, again, that kind of comes to this idea that the APA manual, or DSM, the Diagnostic Statistical Manual for Mental Health Disorders, is symptom focused. We see the symptoms, we give a diagnosis, and then we're typically treating a way to remove or decrease those symptoms. So, for example, if we reduce the symptoms, we improve function. Depression is seen as a symptom from the medical model of low serotonin levels. So therefore, if we find a way to increase the serotonin levels, the depressive symptoms will dissipate. So that's why we can prescribe selective serotonin reuptake inhibitors. In theory, or hopefully, that's going to increase serotonin levels, which again is going to reduce depressive symptoms. From the medical model, we don't always need to know the cause of why the symptoms are occurring. We just need a way to address the symptoms, which will allow a person to go back to a more functioning life or component. So now let's move on to psychologists. So psychologist typically is trained in a specific discipline, right? Because psychologist is a very broad term. We can have psychologists who do not work in the clinical side. We can have psychologists who are more research-based. And then there can be many different disciplines of psychology: educational psychology, cognitive, social, personality, etc. So most common disciplines in the mental health field are going to be our clinical psychologists, our counseling psychologists, and school psychologists. So again, they're all psychologists. They just have different trainings and different philosophies and different kind of focuses on how to address mental health. So it's just psychologists are typically going to have a terminal degree, such as a PhD in EDD, which is a doctorate in education. So that's why you'll see, your school psychologist, it's not uncommon to have a DDD or a PsyD, which is doctorate in psychology. So the distinction with the PhD and the PsyD, PhD is historically more research-based, and then the PsyD is more clinical-based. So a PsyD, you're going to have more clinical classes, where a PhD, you're going to have more research classes. So again, the major association is the American Psychological Associations. There are many different divisions in the American Psychological Association. The division is like a subgroup that has a specific focus. So there's a division on, trauma, division on sports psychology, humanistic, psychoanalysis, etc. So with your psychologist academic training, typically you're going to have 4 years of undergrad, followed by 4 to 6 years graduate, and then fellowship possibly. So the big thing with psychiatrists and psychologists, these typically are going to be people who refer to as doctors. So we're going to have medical doctors, and then we're going to have doctors of philosophy, doctors of psychology, etc. So really, what makes psychology unique is a scientist practitioner model, and typically this is associated with PhDs. So this is also known as the Boulder model. So it's the initial guideline for clinical psychology graduate programs that are accredited by the American Psychological Association. And also counseling psychologists have a similar framework too. They're influenced by the Boulder model, especially if they have a PhD. So some key elements are psychologists should be trained in assessments and testing, and that's what makes psychologists really stand out, is they have a long history of giving psychometric tests and assessments using that. So even the birth of kind of mental health in the United States, psychiatrists have been more the medical interventions, and then psychologists have been more of the assessments and testing, and they have kind of a strong interwoven relationship with that. And to give some history, for a long time, what kind of fueled that was World War II, World War I and World War II, and then for a while, psychiatrists believed they were the only ones in the United States that should provide medical treatment. But with the explosion of World War II and the aftermath of all that, there was a need as many mental health providers as possible. And then so psychologists not only had the experience of doing assessments, but then they were kind of more accepted into doing treatments. So again, assessments and testing was what is kind of like the strong foundation that distinguish psychologists from other disciplines. There's going to be a strong integration of scientific findings, so the evidence-based practices, as well as using research methods. So that's the scientist part. And then there's going to be a promotion of interdisciplinary collaboration, and then use of study evidence based on practice. So that's going to be the practitioner element with that. So the psychologist is going to be trained to be a scientist as well as a practitioner and to integrate those components. So research-focused, evidence-based practice focus is going to be a strong element of a lot of psychology programs. So with that, I've used the term evidence-based practice quite a bit. Let me exaggerate or go into more detail about it. So this is according to the American Psychological Association, that evidence-based practice is defined as the integration of best available research with clinical expertise in the context of patient characteristic, culture, and preferences. So essentially, we work backwards. We have a consumer, a client, a patient in front of us, and they have certain symptoms that's being presented. They have a personality characteristic that's unique to them. Their culture, as well as their own goals, are going to play into what type of therapy or modalities or treatment we're going to use. When selecting treatments, we want to make sure the treatment we're using has evidence and research to show that this treatment is effective. And ideally, we want to make sure that treatment's effective for as many domains that the client is presenting. So when selecting treatments, you should be familiar with the latest research. So continuing education, always learning as much as you can, being a lifelong learner, etc. Should also have significant training and then supervision of the treatment. So if I'm using, let's say, EMDR, I should have supervision on EMDR, and then I should also have training to use EMDR. And the treatment, again, should fit the consumer's presenting concern, cultural background, and personal preferences. So that's a quick snapshot of evidence-based practice. I'm connecting it to psychologists, but again, evidence-based practice is going to be terms that are used in every mental health discipline. So let's move on to social workers. So there's various levels of social workers. We can have a bachelor's, a master's, and a doctoral, or a DSW or a PhD. So it can be clinical and non-clinical. It's historically focused on systems perspective. So there's a strong kind of relationship between social workers being applied sociology. So there's a connection between the sociology field and social work field. So the major association for social workers is the National Association of Social Workers. And typically the academic training, it's going to depend on the role and tasks one wants to do and how one can enter the field. So most people can be called a social worker with an undergraduate degree. For more advanced skills and ability to diagnose, they're going to need advanced training in clinical work. So an individual typically, in order to do mental health therapy, is going to need a minimum of a master's degree plus specialized training, depending on academic program as well as the state. So systems perspective. So the systems perspective sees that an individual behavior is influenced greatly from external elements. So these external elements could be social status, family, peers / friendships, the environment they're living in, as well as social institutions are all going to form a system that is going to influence one's behavior. So compare this to the medical model where our physical body is what's causing symptoms, so it's very internal, and then comparing to many other disciplines, especially in mental health in the Western perspective, it's very individual. The issues are coming from within the individual. Social work takes a more systematic perspective where the behavior is being impacted from external large forces. So that's why, with systems perspective, we're going to see interventions unique to addressing the system. So it's external to the person. So then that's why it could be beneficial if someone's in a relationship. We can do couples work, family work. We can address or change the work school environments and even address larger groups, whether that be through social justice or advocacy or even policy development. So again, from this perspective, systems are really strongly connected. So if we change one part in the system, it's going to have impacts in many different parts of the system, or it's going to impact another part. So we can view this from two lenses. The micro lens, if I change the individual is going to have an impact in changing the external forces. The macro element is if I change the external forces, that's going to have an impact on changing the individual. So that's, again, it's not unique to social workers, but that's typically their strong perspective. Social workers, in my opinion or my experience, are really good at understanding kind of the macro picture and have a lot of training in understanding policy, resources available in the community, and really advocating on more of a macro level. So counselors, that's my discipline. Counseling can be broken up into various sub-disciplines. And I think also what's hard with counselors is our name is not a protected term. So anyone can call themselves a counselor in a way. And what I mean by that is counselor can be a school counselor. It can be, you hear a camp counselor, there's times people like, I introduce myself, I'm a counselor, and I think I'm a lawyer. So the name itself is used quite a bit in many different disciplines. So when we're talking about counselor here today, we're talking about the professional counselor, and the professional counselor can be part of different subcategories. So we can have a mental health counselor, which obviously is focusing more on mental health concerns. School counselor, it's going to be similar to your guidance counselor or terminology, and their setting is going to be in school. We can have a rehabilitation counselor, which is more vocational in nature, and also a pastoral counselor. And a pastoral counselor is someone who's using theological and spiritual concerns and providing counseling with that. So in addition, we can also have licensed marriage and family therapists can be part of counseling depending on the state. So for example, in Maine, LMFTs, licensed marriage and family therapists, which are their own unique profession, are integrated into the counseling field in Maine because LMFTs are not as widely popular as they are in other states. For example, California, LMFTs are really, really popular. It's a strong identity there, not so much in Maine. So that's why they're in Maine, they're at least kind of connected to counselors because they fall on the same counseling board. The major association is we're going to have the American Counseling Association, and then we also have the American School Counseling Association, ASCA. So academic training to enter any of these subdisciplines, and again, there's much more out there, but these are the common ones. You're going to need at least a master's degree, and a specific subdiscipline is required. What makes counselors separate from social work, psychologists, psychiatrists, is the use of the strong integration and training of the wellness model. Social work is going to be mainly taught in systems perspective. Psychologist is the scientist practitioner model, and then psychiatrist is the medical model. Here, counselors, we have the wellness. So the wellness takes a very holistic view of the human being. And for example, the holistic view is going to have emotions, physical body, career, vocation, social relationships, and spirituality, just to name a few. Traditionally, there's two paths that developed the counseling profession. On one path, we have the vocational or career guidance movement, starting with Fred Parsons in the early 1900s. That focused on career development. That kind of segue really paved the way for counseling and is still highly important in the professional development of school counselors. No matter what discipline or subdiscipline a counselor is, they have training in career development and career counseling. That's still a strong identity to us. The other integration component is counseling is highly influenced by the humanistic and wellness models that really flourished in the 1960s and 70s, stemming from Carl Rogers, Abraham Maslow, even Fritz Perls. So essentially, that's the distinction where there is a foundation of learning, person-centered and Rogerian therapy, and being the foundation to this. That's why you have a distinction between clinical psychology and counseling psychology. Counseling is more of a holistic wellness model and does not necessarily focus on specific pathology, but nor focuses on wellness. So, counseling historically is promoting on growth rather than changing the consumer. And then, like I said, the historical foundations, we're going to have human development, career development, and humanistic movements are kind of what have influenced counseling. So again, the big hallmark is the counselors have a tradition in career development as well as holistic humanistic kind of emphasis and theories. So recommended best practices. So we're kind of covered all the fields. Again, I have not covered occupational therapists. I haven't covered nurse practitioners. I haven't covered peer support or life coaching, or there's numerous ones I didn't cover, but those are kind of the typical snapshots of the area with the purpose of showing that a lot of the disciplines have different expertise and views and philosophies on when working with people. So recommended best practices. When working in the field, use professional judgment when providing services. Have knowledge of the various governing bodies that oversee your professional licensure or certificate. Be aware of professional ethics, including scope of practices, code of ethics, and ethical decision-making models. Again, continue to be a lifelong learner by staying up to date with important and relevant literature and trends. Then make informed decisions when using selective interventions, treatments. Know the purpose of the intervention. Be up to date on the evidence related to the intervention. Know the benefits and risk of any intervention, and be able to communicate this information to consumers, clients in an understandable manner. So really, with all this, I want you to be respectful and aware of culture and societal factors that are important to the client consumer. Understand that cultural backgrounds may need to be considered in order to provide the most effective treatment. When making ethical professional decisions, document the decision-making process and utilize appropriate sources, including relevant legal and professional conduct codes. So summary with all this. Professional conduct and guidelines designed to give direction on how a professional should behave. Again, it's always with the purpose of protecting the consumer. Each mental health profession is going to have unique professional conduct, such as scope of practice and code of ethics. Each discipline has a unique perspective. Therefore, it's going to be common for teams to work together to address the needs of the consumer. When working on a multidisciplinary team, communication is key. Don't be afraid to be concise in your communication, use check-in questions, and ask for help when needed. So here's the references. Thank you for your time. I hope you enjoy the rest of your day. And let me stop recording. Have a good day.